is Dr. Nylund, who's going to talk to us a little bit about children and families.
Thank you, Dr. Biaki. So let me just real quickly, a little bit about my background is I mainly have worked in mental health context. I worked for Kaiser and survived that and nonprofit. And I'm the clinical director of the Gender Health Center, which serves trans and queer communities. And I have a background also academically in cultural studies with a focus on critical theory and queer theory. I have a lot of knowledge, though, of working in child welfare. I've taught those sections since I started at Sac State in 03, the practice section for Title III students. And I do a lot of supervision with school social workers who are earning hours towards their license. In my private practice, I mainly work with trans youth and families and also couples. So I pretty much see myself as, in addition to being a social worker, as a family therapist. Okay, you can move forward.
And Dr. Nylund, I should warn you, I beautified your slides a little bit last night. I added some stock photos of families and stuff.
You're awesome. Thank you.
Sure, of course.
Did you do this one?
I just made the font a little bit different.
It's amazing. So child and family is pretty broad. Obviously, if you're in Title IV, that's the specialization for you, but there's folks who are in foster family agencies, schools, even behavioral health settings, some macro settings like NESW. I have a student who's at NESW this year. So I guess I'll read it. Train MSWs to improve the lives of children, adolescents, and families through psychosocial interventions and building a framework around that includes clinical supports and case management, looking at developmental stresses, etc. And it's an advanced practice that I think the way that we teach the class, the two sections, my colleague Todd Featherston this year, is it's a way of approaching the work no matter what setting you're in, as it applies to working with children, youth, and families, so including macro work. You can move forward. Way to go. So here are some of the practice settings. I kind of mentioned them that folks who have been in child and family concentration, child welfare, schools right now, I think in addition to what Sarah said around health settings is without a doubt, school social work is a growing profession. Like there's so many jobs. There's a lot of Title III students, they worked for a while in child welfare, they're 2 years and so forth, and have recently been hired in schools. So there's huge need for school social workers. They're getting hours towards their license. And there also is, I don't know if people are familiar with Sacramento County Office of Education. They're committed to putting a mental health clinician in every school in the county, which is happening. So schools is a big one, family service agencies. There are folks who've taken child and family who are in a mental health setting. I do supervision at La Familia and works with youth and families. So there are folks in those settings, also corrections, Alta regional centers with children with disabilities, substance abuse treatment for youth, and hospitals, and then macro services, and of course, folks and children and families who are experiencing homelessness. So here are some of the things that we focus on that you'll learn. So we start out with an overview of the theoretical and ethical framework for working with youth, which combines some more traditional theories, but also we do a lot of work at looking at, working with youth and families from a critical theory perspective. And then we get into a book by Nancy Boyd Webb. It's social work practice with children, and we look at how to do what she refers to as a tripartite assessment. And people do a biopsychosocial with somebody, a client they're working with. We do, because you're working with youth and maybe their preferred medium of expression isn't talk. So we do a lot of work. I have a background in it in play and expressive therapy, and also working with families. When I first got into the field, family therapy was a practice that in many ways was developed by MSWs, and it's been sort of a lost art, I think, for a lot of reasons. But so I do a lot of work, and working with parents and caregivers, because that's key if you're going to work with youth. I also teach 226, which is the family therapy course, which I think is an elective that's congruent with this concentration. We do focus on some of the DSM diagnoses for children and adolescents. Like I have somebody come from the regional center to talk about autism. I have a lot of background with ADHD. So we look at the diagnosis and also, like depression, anxiety, how that looks differently with youth. But we also look critically at some of the diagnoses like opposition to fine or conduct disorder. We learned some about like meds, a lot of work on trauma and neurobiology of trauma. There are two, there might be a future slide of this, but there's two, once fall semester, people take a course on PCIT, parent-child interaction therapy, and you get credentialed. You get credentialed. It's a pretty rigorous course. So that's the assignment. In the fall and the spring, folks take a course on trauma-focused CBT, which is considered the evidence-based practice in working with adolescents who've experienced trauma. We do some work, if you're going to talk about trauma work, it's important to also have some background in the neurobiology of trauma. We do focus on CPS, but from this other model that we've kind of developed and borrowed from some of the work that's looking at it from this collaborative framework and using this collaborative helping maps that people find useful. In the second semester, we do a course on, or a class on substance abuse treatment, a huge focus on school counseling. And then we also folks learn a measurement outcome system called feedback informed treatment, which is a great way of like one of the competencies, I think it's competency 9 is about evaluating your practice and this simple measurement to privilege the voices of young persons. All righty, thanks. Wow, more that you'll learn. Working with, if you're going to work with youth, right, there's multiple systems involved when you're working with youth and families. So collaboratively working with various agencies, schools, child welfare, if they have any interaction with the criminal justice system, teachers, etc. We do a whole class on, because if you're working with youth, they're mainly they're fashioning their identity often and constructing a lot of their social supports, and identity construction, I guess, is popular culture, social media. So we do a class, I've done some research in that area of how to utilize pop culture and the mass media, different forms of pop culture, to how to use that therapeutically with kids and engage with them. As I said, a few minutes ago, we work and talk about children with disabilities, LGBTQ youth. I do a class because that's my background in working with trans youth and mainly their parents. Criminal justice work, looking at issues around housing and also policies that impact youth and families. And what does it mean to be a true advocate? Next slide. All right, I like how you changed this. This is great. So these are some of the theories that we focus. Obviously, you're going to work with youth. There's a big focus on attachment theory and developmental theories. We also look at youth and developmental ideas from a social constructionist lens and how that lends itself well to kind of an empowerment-based practice, family systems model, queer theory and critical race theory and feminist theories, and how that applies to working with youth from a social justice critical perspective. Next slide. And then some of the practice models, PCIT, trauma informed practice, trauma focused CBT, some of this like collaborative models with CPS, historically it's been called safety oriented practice, play therapy, family therapy. We do a course or two on the evidence-based model for working with families called functional family therapy. A lot of agencies that work with youth and family, the social workers and clinicians are trained in FFT. A lot of, focus on empowerment models, solution focus. My background is in narrative therapy and how it's congruent with social work. Looking at schools, I talked about the feedback informed treatment, which is a way to measure outcome. We do a class on motivational interviewing and how that relates to youth, and also restorative justice. I teach the restorative justice class in the spring, social work 215. That also, I think, is another elective that fits with children and families. That's it.
That's it.
I put my email address if you have questions. If there's any questions right now.
Well, I just want to say, Dr. Nylund, as you were talking, I was reminded, and we might have talked about this before, but in my previous child welfare life, I worked at an agency for 5 years with families, and you came down, I think, as a graduate student in Davis at the time, and you gave us this talk about the use of pop culture in interventions with families. You probably don't remember that.
I have no memory of that.
Yeah, and it wasn't until very recently that I made a connection that it was you, because this was just it was a couple years ago, I'll just say that. And I remember when you left, everybody was just so taken back by this kind of positive cultural critique, critical theory approach that you were bringing to child welfare, because child welfare sometimes is very rigid and normative and very concrete things. And I really appreciate how you've infused the curriculum here at Sac State with this more empowerment focus orientation. And I think like that our students really benefit from that. I think it makes it a very cool way of teaching this area of social work. So as you were talking, I was like, that's right. David came in and gave this talk and kind of just reoriented this whole way that this agency was working with families. So I don't know if I mentioned that before. Apparently I didn't.
No. Wow. Was that quite some time ago?
This was probably 2003, 2002.
Yeah, I was still in my cultural studies program at Davis.
Yeah, because I remember they're like, oh, we have this doctoral student in cultural studies going to talk to us about child welfare, and we were like, what? Who is this guy? But it was great. I know we have a question, so I want to give Tyran a chance to ask their question.
Sorry, I always come up with a question, Dr. Bayaki.
Yes, you do. Excellent.
So there are a bunch of us wondering this about the children and family specialization. If we want to do school social work, and especially if we're applying for the Golden State Teacher Grant, which requires you to be in the child and family specialization, what happens if we don't get that as our preferred specialization? Because we have grants writing on it and stuff like that.
I don't think the grant can make it conditional that specialization. You obviously, if you're working in schools, I think there's a very good chance that you'd get in. But I don't know if so I'm answering the question for you, David Nylund. But
I wouldn't have the answer probably.
Well,
yeah.
So maybe we can talk about it later, but Dr. Aguayo in the email that he had sent said that you do have to be in that specialization for the grant. So I know there's a bunch of us who are really anxious about if we don't get that, then we're not eligible for the grant.
Well, obviously, we want you to be eligible for wetter funds, and we want folks to get into the programs. I mean, honestly, we would try to figure out a way to do it. But I just don't know off the top of my head if that's exactly concrete as that is. But It's great that the state is funding that, because we obviously need more social workers in schools, and great to hear that there's this new funding stream.
Okay.
Yeah, they can't fill all the positions. And Sacramento County Unified School District is also now providing and paying for their supervision for their license. So thank you. Don't hesitate to ask questions. My section this semester, I think a good 80% of the students in my class are in school. So there's a lot of excitement in the room in terms of working in schools, which is really true multi-practice social work. So yeah, thanks Arturo. Thanks, Dr.
Sure, thank you, David. Thank you, appreciate it. And to do a quick time check, first of all, thank you, Dr. Kinney, for staying on. I think I was completely unrealistic about my timetable, so sorry to have you stick on. And I just want to give a time check to folks. We're reaching about an hour. We had said that this meeting is going to be an hour. It's going to be probably more like an hour and a half. I understand if you have to jump out, this will be recorded, but we do have some pretty critical information in the back end in terms of administrative steps. So I encourage you to stay on if you can. With that being said, I'm going to introduce Dr. Kenny to talk a little bit about behavioral health. So Dr. Kenny, the floor is yours.
All right, thank you so much. Well, thank you, Dr. Bianchi, and so good to see all of you joining us to have these conversations about the different specializations. So thank you very much for inviting me. So I'm going to talk to you about the behavioral health specialization, which is primarily where I teach. And just a little bit about me. So after I got my MSW, I had about 8 years of clinical work and primarily working with men and women who were struggling with substance abuse, mental health. And my primary focus has been working with folks who are just as involved, specifically women who were struggling with drug and alcohol, substance abuse.